Hello, and welcome to Hope and Healing. My name is Jeff Friedman. This is a new show on local access, Creative Tucson, and the overall subject of the show is going to be mental and emotional health issues, how those are treated, how those can be recognized, and some ideas about how a person can recover if they are suffering from one of these disorders. So each week we're going to sort of have a narrow focus. This week I have as my guest Peter Biava, professional counselor here in Tucson. And one of the things that Peter does, and I think he does very well, is working with adolescents in the context of their relationships with their family. And when I invited Peter on the show, he said that he had interest in talking about anger management, anger problems with adolescents and young adults. So I want to tell you a little bit about Peter Biava. He is a therapist in private practice here in Tucson, a 1997 graduate of the University of Arizona, and he's an Arizona licensed professional counselor. Did his undergrad work at Old Dominion University in Virginia, and he is a former primary therapist at one of the local treatment centers here in town, and has worked with adolescents, young adults, and adults in a variety of mental health and behavioral contexts. So, Peter, we're sitting here in Tucson, Arizona, and yet you did all of your training on the East Coast. Are you from the East Coast?
Yeah, originally grew up in New York, right outside New York City on Long Island, and went to school at Old Dominion and actually majored in human services counseling, which was really an undergraduate degree focused on general counseling. Came out here and actually did my work at University of Phoenix and finished that in 1997 and been practicing really ever since.
What brought you out to Arizona?
Actually, I was a commercial pilot at the time, and I was building hours. Yeah, I was building hours to be sort of on an commuter airline track, but that career didn't work out, and got into doing therapy and been doing it ever since. So,
well, I'm glad that the pilot gig didn't work out so well because, and I've known Peter for years, and I'm glad that we have you on our team.
Thank you.
So I'd like to ask you some questions, and so you can talk about some of the things you think are important to bring out on the show. So the first question is how you got interested in working with anger issues.
Yeah, it was really interesting. My first job after undergrad was actually working at a wilderness school in rural Virginia with behaviorally challenged and emotionally challenged young boys. Yeah. And it was a really intense environment. And when I worked there 24 hours a day, 5 days a week, and then had 48 hours off. And it was very intense. And when I got there, I realized I don't know anything about anger. And these kids are really pissed off. And I figured I better learn really quick. And I only worked there a little less than a year. But in that time, it really taught me that I had to sort of look at my own anger issues and understand what anger was doing for people and not doing for people, especially in the context of adolescents, because these were everybody under 18. And later, as my career advanced, I did a lot more work with young adults, 18 to 26, and general adult population as well. And anger just comes up over and over and over again as a way people cope with things and also struggle to cope with things. Right. And can make problems worse or can also make problems better. So that's really where it all started back there at this, it was called New Dominion School, and ignorance will make you motivated to learn something, and I clearly got it there.
So it sounds like you saw a lot of angry kids.
Very angry kids, and most of them in the rage. They're really good at raging, and I was not. My message from my family about anger was my mom was really intense, my father not so intense, and I had to learn, okay, what do I do? What am I doing with my anger? What are these kids doing with anger? And what is reflective of it on a deeper level that needs to be addressed?
So do you think it's necessary for a therapist if they're going to be working in anger management to get a better understanding of their own anger?
Yeah, absolutely, because it's good to frame how you see your client's issues. And I tell this to all my clients, that if you're getting stuck in an anger pattern, start looking at your family and start looking at the origins in your life where things came from, because that stuff gets modeled and we pick it up at very early ages, 2, 3, 5-year-olds. I have 2 young daughters, and I can see how they do anger very similar to my wife and I. Yeah, so I had to do that for myself. I go, oh, my mom does anger this way, this influences me. Passive aggressive ways at times, aggressive ways at times, not assertive, and you have to look at that in order to understand it, particularly when you're not angry. I tell people that struggle with anger issues, trying to understand it when you get angry is much harder. You want to click into coping skills. But when you're not angry, you want to look at what circumstances caused your anger and then do some work to prepare for the next time around.
That's what I thought you were leading to work on it when you're calm. And then to apply any insights that you've gotten, anything that you have learned, any patterns that you see, the next time there's an angry situation. Does that work well for you? Or?
Yeah, it does, actually. And I've seen it work really well for clients, because the model I like to frame for people is it's really one of 2 ways. Your anger is either constructive, anger showing up, and you do something with that angry feeling in a behavioral sense that addresses your challenge, and I call them perceived threats, because that's usually what it is for people. Or your angry is destructive, where you do something that's either too aggressive or too passive, and it doesn't address the perceived threat, it doesn't address anything deeper that's more underlying, and your relationship with yourself and your relationship with other people is still jangled and troubled and problematic.
Can you give viewers an example of anger that was a positive kind of thing?
Yeah, I mean, it happens all the time for many, many people, especially in the constructive angry mode. When somebody, I like to say, when you're using your anger constructively, your behavior related to your feeling, anger's a feeling, behaviors are something you do, is assertive. I teach...
And congruent.
And congruent, Teach assertive responses that are congruent. So you and I actually had this, I mentioned this earlier to you, we get together...
Tell the audience what a pain in the neck I am.
Well, I actually thought it was, it popped in my head because it was one of those things where I clearly didn't recognize that my behavior was having an impact on you. So we get together for lunch on a regular basis. I had been late pretty consistent, like 2 or 3 times. On the time I showed up, I remembered you were angry and you confronted me about it. And you said, look, you're late. This is not cool. What's going on with this? And I realized, holy cow, I'm not prioritizing my time. It's disrespectful to your time. I'm making you wait. It's an inconvenience, these sort of things. So I got that message loud and clear. You said it in a very direct, firm, assertive manner. And I changed my behavior, and I try to be on time, and generally I've never heard you address it again, and that's been at least a year ago.
Well, I'll have to think back. So, yeah, I remember that time, and I think you're right. I don't think you've ever been late.
I try not to.
Since then.
And again, like when people do it the other way, where it's destructive, then it'd be the kind of thing where, like, if I keep showing up late and you keep getting pissed off, and I'm going and getting defensive about it, and if I'm reacting with anger to your anger, that's not really addressing anything. And if something going on for me, that's getting defensive about it. And when I work with clients, I really want them to slow down and look at that stuff. So that's generally my framework.
Well, then let's get sort of into the real meat of this. What principles do you employ when you're treating anger, either with an individual or maybe with a family?
Yeah. So the main principles I like to follow as a therapist, I'm tracking these, but also to share with clients is you have a behavior you tend to go to when you're angry. So for people that got modeled, really strong angry expressions, rage, pissed off, these are the people like road rage, that sort of things. That's a behavior. And as a therapist, I want to hear that.
Other than road rage, what common behaviors do you see in people that just let that anger
Oh,
go?
yelling, leaving the house, temper tantrums, all these sort of stuff. Really trying to control the situation. That's the sort of standard stuff. And I want to track the behavior, but it's the least useful place to try to set up a structure like, okay, every time I get angry, I'm going to do this, because it doesn't tend to work. Because underneath that is some kind of anxiety. And I want myself to be tracking, and I want the client to get oriented to what anxiety is driving my anger. So in a lot of times, it's fear. It's a worry about being hurt. And I think in the case I mentioned with you was, I'm being genuinely disrespectful. Like, I'm not honoring your time, right? And that's, for a lot of people, that's incredibly valuable. It's like, so there's the anxiety of like, every single time I'm going to have lunch with Peter, he's going to show up late. That's not cool. So that's the anxiety that's underneath it. So for me, and even for you then, or for somebody struggling with anger issues, there's a developmental task associated with that. You could have been super passive aggressive about that and started showing up late, right? You could have been super angry about it and like blasted me in a way that was disrespectful.
I'm not entirely clear on the developmental tasks. So can you explain it, back up like 2 stops,
Sure.
and explain what a developmental task is and what developmental tasks we might have or adolescents might have?
Yeah, adolescents in general have the developmental task of figuring how to regulate their emotions, right? Adolescents, in particular, and young adults, is, wow, I've got more autonomy, right? More freedom, but I'm still in the construct of my family and my parents, and they're still paying the bills. So I'm in the structure of, I feel more powerful, I'm more insightful, I understand things, but I have to listen to their rules. So the anger is, how do I express the anger in a way where my parents will understand that I want to have some control over my life, I want to have some decision-making and influence. Those are developmental tasks for adolescents that are pretty typical. I use the old reality therapy thing with adolescents and families. It's either freedom, fun, power, or love. You can generally slow down behaviors.
On the side of the adolescent.
Yeah.
That's what they're kind of feeling they need it.
They're wrestling with.
Okay.
I'm trying to, do I feel powerful in the world? Do I have enough freedom to do the things I want to do? Am I having enough fun? What does that fun look like?
Right.
And is there love connections and interpersonal connections? So those are developmental tasks. Those same developmental tasks might apply to parents of adolescents or young adults. So for them, a lot of it is letting go, right? And not being overly controlling. I mean, parents are essentially working themselves out of a job as their adolescent young adult is getting older. And it's very hard for many of them to go, ooh, my son or daughter is doing this thing that I don't really like and I'm really kind of freaked out about. How do I manage that? And they could manage it with anger. So there's a way where it could be too overbearing, and the developmental task of tolerating the discomfort of, now my young adult is becoming more of an adult. My adolescent is going to have more freedom. And it's very frightening. They have their developmental task means managing their own fears and anxieties around the new independence and the new person that from childhood they were, and now they're a new person.
Well, let me tell you something, because I know you have 2 young daughters. How old are your daughters?
5 and 9.
Okay. My daughter is 44. And so I've been through some of this, and you've got it coming to you.
Yeah, of course.
And I remember when my daughter, even when she started dating, that was difficult for me.
Right.
And later on, she was involved. She didn't use drugs, but she was involved with people who did, and people who did other things that scared me.
Sure.
And even some things that I had done at that age that now I disapproved of. So I'm just saying to you that for me it was very difficult and confusing.
Sure.
And I'm not sure that I've got it straightened out yet, to tell you the truth.
And that actually really segues into that last piece of my construct that I also like to guide, support clients going to is, there's the behavior, there's the anxiety, there's developmental tasks, but really underneath even the developmental task is, can I be vulnerable, really, really vulnerable to that deepest truth of the emotional connection I have with the person I love and my own vulnerable feelings of the thing I can't really control, right? It's easy to control, to jump into anger and get into a control mode. It's really functional that way. And by the way, that's useful when it's constructive.
Yeah.
But if you're really vulnerable to, oh my God, I'm really afraid my daughter's doing drugs, or she's dating this guy, or my son is going to make this really risky choice, being okay with that vulnerability and speaking it in a way that's not about control and anger, but really your own vulnerability, it's way more effective. And it changes your whole relationship to anger, changes your whole relationship to the person that you may be in a conflict with, and changes your relationship to yourself. And that's powerful stuff.
Indeed, but also easier said than done.
Oh, absolutely.
So is there some way, do you think, or some practice that a person can adopt that would make them less reactive, less defensive, more able to sit presently with the anxieties of life, and allow that vulnerability to be there?
So this is in my practice, I teach people and really try to encourage people to do mindfulness-based practices. And mindfulness really means being aware of what you're doing in the moment in a very compassionate and non-reactive way, and really non-judgmental way. It's very hard to do, but there's various techniques that you can learn and talk through. Some people aren't oriented to that way, and that's fine. But
you know what techniques? Give us one or two.
The simple ones is stopping and breathing, right? And also slowing down and noticing your breathing in a non-reactive context. So just practicing, okay, I'm here now, I'm on the set, I'm talking to Jeff, I'm relaxed. I could be really nervous because other people are going to be watching this, but I'm okay with myself. It's a moment of mindfulness. I don't judge it. I might look goofy to some people, I might not. There's a mindful moment. And if I practice that in relation to, oh, okay, my son's making choices that are freaking me out. Okay, what do I do with that fear? What's underneath that fear? I want my son to be safe. I want to stay in connection to my son in a really deep way. How do I do that when I'm afraid? This is mindfulness that I use regularly, and I see people use in practice all the time. That's very helpful to changing your relationship to anger. Because you're not in a rageful place, you're not in a passive-aggressive place, you're less reactive. And the main three pieces I tell people are, calm yourself down, learn how to self-soothe, learn to confront yourself. Self-confrontation really helps to ease some of these stressors down, right? And then, of course, share it with somebody, self-disclose it to somebody else. Because you managing it inside your own head, useful, but not as useful as getting feedback, getting somebody who really cares about you and knows you to give you a sense of, hey, okay, this could work, or this is going to have this piece that you might miss.
You know, in my work as a chemical dependency counselor, one of the things that the field of chemical dependency counseling, has struggled with, at least since I've been involved with it, and that's about 30 years. But what I think that it's important, and what I think it's hard to get clear is, what is exactly the nature of this problem? And so in addiction counseling, they say, well, you know, it's, the person is looking for some kind of ease. Another paradigm will say, well, you know, it's sort of antisocial behavior, and we get hooked on that. Then somebody comes along and says, it's not about the using of substances, it's about the feelings that trigger the using of substances. And then, thankfully, a whole other area of exploration with addiction is, what exactly is happening in the brain when a person takes a particular kind of drug? And that has been really helpful to me in kind of getting a sense of what at its crux are we dealing with? Because if I start dealing with the behaviors up here and the relations up here and the legal problems, I'm still not getting to it. So it's refreshing to hear you say that at its core, it's all about difficulty in being vulnerable. Anger is about, or partially about.
Yeah, and I think also you could even take that as, and that's really about relationship, right? Vulnerability is always in relationship to something. So you could always, someone, including yourself, right? Yeah. So I'm always asking myself, what is this client struggling about in their relationship to themselves? Can they be more honest? Can they face things they're afraid of? Can they be more vulnerable in an external relationship? Right. Are they trying to shift a pattern that got established when they were a child that they haven't been able to break out of? And of course, with adolescents and young adults, it's a given, because they're growing into the person they want to be, and they're not there yet.
And you're basically talking about every adolescent at this point.
Exactly, because they're in some stage of dependence and independence. You know, that process of, like, you know, I've seen 12-year-olds in my practice totally in a very dependent state. Now they're advancing in through their teens, more independence, but still relying on their families, you know, and friends for a lot of things, off to college, or young adults that are more independent, and then into adulthood. So that piece about relationship and vulnerability to the deeper truth, finding things that really you have a hard time being honest about, but are like, this is what I'm most afraid of, or this is the thing that wounded me the most, and I'm willing to look at it, so I don't come from an angry place where I'm avoiding that stuff. Anger can be a really ugly distraction from looking at this really great deep places that people need to heal. And it's, if you peel that anger back and get people focused on what's happening with my relationship with myself. I'm terrified I will never, I've had patients say this, I'm terrified I will never be that vulnerable again. And I go, right, and if that's the case, you'll never figure out how to calm this anger down. That's messing up your relationship. It's in, you know, your boyfriend or girlfriend isn't going to tolerate the way you're doing it because you don't want to be that vulnerable. And I get it, because they were wounded somewhere.
But part of a recovery practice is to purposely put myself in situations where I'm going to feel very vulnerable, and then to sit presently with it. I don't want to push it away. I don't want to grasp onto it and hold it. And it will be with me as long as it's going to be with me.
It's the amazing part you see with people with substance abuse and addiction issues, the courage you see for them to peel away their drug of choice, which does something very beneficial and positive for them, and then launch into other behaviors where they're much more raw. And it also explains why the relapse is so high, and self-condemnation can be really high. You need a lot of caring and compassion and structure to help them go to an AA meeting and do something sober, or go to an NA meeting being open in a way they've never been, because they've been in a cloud of some kind of chemical use.
Well, now you've sort of triggered me to a rant, and this is not what the show's about, folks, but there has been a sea change in chemical dependency treatment in the United States in the last few years. And the treatment centers, and if you name any of the top shelf treatment centers that are in the United States, every one of those that I know of has abandoned an abstinence-based approach for recovery and embraced a medication management approach. And that's fancy language for opiate addicts leaving treatment on methadone, and alcoholics getting some other combination of things that could be abused. So, you know, to me it's a shame, because when a person goes to treatment, and the first thing that happens is they're medicated, and then they come to group, and you or I are running this group, and we are purposely structuring things so that this person will have no choice but to be there with that anxiety over the vulnerability. But they're not anxious over the vulnerability because they've been medicated with Suboxone or methadone. And then we're asked to help them to deal with this. How can you do that if the person isn't going to be anxious? I don't know.
It makes the process that much more challenging because
Yeah.
it lengthens it out. I mean, if some people can gradually get off of those, whatever they are, helping type medications to manage mood, fine. But then you have this extended period of time where they're slowly trying to come off this, and
Yeah.
managing their feelings is a different world because the chemicals are there to help them. So it's a challenging piece. And in terms of anger, it's going to have implications for how they feel anger, address anger, can learn assertive responses or non-assertive responses.
If you have an angry patient who's also an opiate addict, and you see a lot of anger, and the anger, underneath the anger is fear, and I'll tell you the specific fear is that they're going to take them off the medication.
Right.
And they'll do everything they can to make sure that that doesn't happen. And I feel bad about it because, to be able to live without chemical crutches, without behavioral crutches, to get to the place where I can be vulnerable and I can share my anxiety and anger with other people. That's the promised land as far as I'm concerned.
I've been lucky because I have a few people in my practice who are on methadone and are really very courageously doing the work to try to come downhill and get it off. It's very hard. It takes a long time.
Yeah.
But to see them come in and wrestle with their emotional issues, and as you see the decrease in medication, more intense emotional feelings are coming up. So I'm hopeful that that'll work over time. It's just very elongated. And as an outpatient practitioner, I can do that. Inpatient, it's harder because you only have a certain amount of time, and it's certainly not cost effective.
Yeah. And so I'm really happy to hear that you're looking at this as an opportunity. The discomfort that people are feeling, the anxiety they're feeling coming off methadone or Suboxone, and you're taking the opportunity to use that to help them.
You just have to because, they still have their problems in their life. They still have their challenges. You want to help them track, okay, here's your choices, what's happening for them emotionally. Again, it can be muted and blunted a bit, but you can still do some of the work. So
That's definitely.
Well, Peter, I agree with you, but the problem that I have is that, well, it's not my problem, but what I worry about is that there are a lot of therapists out there that would never take that approach, wouldn't understand that approach, and is working with these people on getting a job and getting them housing and stuff like that. I think that's a little bit too high or too low on the pyramid.
yeah, well, and that's as a therapist, I like to orient myself that, look, behavior change is one thing, but it's really, in some ways, the work that's really going to help you have really sustained quality behavior change is when you're at a deeper way, you're in a deeper place, when you're learning how to be vulnerable, confront yourself, work on developmental issues that help you be more functional. And that, to me, is the kind of work I like to do, and I've been lucky to do it in my private practice.
Great. So, can you explain to the audience what a defense mechanism is, and talk a little bit about some of the defense mechanisms you've noticed in your practice?
Yeah, so the defense mechanism is something we do to avoid managing something that's facing something that's more painful. So the classic one is people rationalizing and justifying, right? I make up all these reasons why I did something, and
I drank last night, but I drank because my wife is such a shrew. Mm-hmm. Okay.
Exactly. And defense mechanisms, everybody uses them. They're common. There's actually nothing wrong with them. The piece is if they become ingrained, and anger itself can be a defense mechanism. I'm going to react with anger rather than addressing whatever I feel more fearful and anxious about. Yeah. And then I'm really using anger as a power move to manage the relationship rather than looking at, whoa, what am I scared about here to look at more deeply? And I see this with adolescents all the time. And I see with parents of adolescents all the time too, because they're essentially saying, my son's not who they they used to be when they were compliant and listening to me. I'm like, they're not supposed to. Teenagers are going to act out. Teenagers are going to rebel. It's your job to adjust to them and relate to them in a different way. And it can activate for parents a lot of feelings from their family of origin that they haven't really addressed. And suddenly teenagers will do that and young adults will do that. So this is where like looking at the system of the family, the system that's going on between, say, a mother and a son, a father and a daughter, and the system that if someone is going on for an individual, a father going, oh, I'm still operating out of these messages from my family of origin. Oh, I've never learned how to really slow down and not power and control this, which worked when they were 5 and 9, but doesn't work when they're 16 and 22. So that's where the defense mechanisms, if you can get underneath it, now you get more sustained change. And people also grow and feel kind of more vital in their lives.
You know, a couple of days ago, I picked up this book by Carl Jung. Carl Jung, great doctor, therapist, psychiatrist, lived about a century ago in Switzerland, and he was kind of a colleague of Freud.
Exactly.
And it was translated from German. It was really dense. I couldn't get into the book. It required too much thought. But there was one sentence that struck me, and Jung said, all neurosis is a substitute for genuine suffering. So I think that's a good way to sort of wrap it up, because that genuine suffering occurs at a lower level.
A deeper level.
A deeper level, where the vulnerability is, where the self-concept is. So, Peter, I want to thank you for coming down and being on the show, on our first show. And I'm hoping that we might be able to have you back to talk about something else. Thank you for watching today. And I hope that you catch our next show. Anyone out there that has an idea for a topic that we could cover here on Hope and Healing, please send it to Creative Tucson. Also, if you're a therapist in town and you're interested in appearing on the show, call Creative Tucson and we'll get in touch with you. So once again, thank you for watching.